In this video, I'm going to give you an understanding of the physiological and psychological responses that occur when there is an injury. I'm going to look at the most common sports injuries and then apply this information to two case studies. So the physiological responses. So one of the most common injuries in sport is a strain. This can happen in 3 different grades, the same as a sprain can, but they're slightly different. So a strain is classified as grade 1, 2 and 3. Grade 1 being a pull. This is where less than 10% of muscle fibre is damaged. This can be from a sharp pain at the time of the injury, but you're normally able to continue. There'll be a mild pain, which is localised in one place. You'll have spasms possibly, and there'll be a loss of strength and your range of movement. So grade 2, this is where 10 to 15% muscle fibre is damaged. This is classified as a tear, and you're normally unable to continue activity, and there's an obvious sign that you have lost the strength and range of movement. So grade 3 is a rupture. Now this is 50 to 100% muscle fibre damage, grade 3. So this will be immediate severe pain and complete loss of function, and you'll have a positive response to the Thomas test. So moving on to sprains. So sprains is what grade 1 is an overstretch. This will be a little pain or swelling, and joint stability will still be okay. However, grade 2, which is a tear, is the moderate instability and moderate to severe pain. Moving on to rupture, which is grade 3. So there's a ligament which is completely ruptured. So the joint is unstable, severe pain and swelling, and other tissues around the area are likely to be damaged. So then we also have hematomas. So we have intramuscular and intermuscular. So intramuscular is where there is an injury which then causes it to like spread and cause like a big bruise. Now this is because there is a swelling and the blood is passing through. So this can be caused by something like a massive collision. So if someone's running and sprinting at you and you're in the way, this is where this will happen. So this intramuscular is where the blood escapes to the surrounding tissues. Compared to this, you've got the intramuscular, which is where the bleeding occurs in like one compartment, so the blood isn't being spread. The damage to this body tissue sends information to the brain, which is where you kind of feel the pain and see that inflammation. This will inflame because of the natural response that occurs as the defense system from the body. So the blood clotting mechanism, this is where there are different stages in order for the bleeding to try and stop. So this is the natural response. So when there is a bleed due to injury, the blood clots initiate the healing process. So the platelets are activated by chemical reactions. The platelets make blood sticky, so this helps to be able to clot. So the clotting mechanism can be explained as the blood clots by having the platelets. So these form kind of a plug in the skin, so these are sticky, will stick together and hold together. As this is not very strong, there is then the proteins which come along. They help to add to this. There's also fibrin, which comes and creates like a glue which holds them together, and then we have other cells which are joined. These act as protection and to hold this as a more strong and robust mechanism. So that is how the clot is then formed. So we have 3 stages of healing: inflammation, repair and remodel. So inflammation is the initial response which happens immediately after injury. This is how the injury is kind of firstly not noticed, because obviously you have pain, but if it's a slightly less severe injury, then the inflammation might give a clue that it is actually an injury. So the inflammation is this emergency response which normally lasts for 3 to 5 days. There is swelling, pain and inflammation. It then moves to the repair stage. This can last up to around 21 days, depending on how severe the injury is, and then it moves to remodelling. Remodelling is where the muscle or the injured area tries to recover back to its normal, how it was before. If there is lots of rest and the right procedures are followed, this repair stage can be done a lot quicker. Food supplements can be taken in to be able to help these, such as omega-3 and selenium. So now we've been through the physiological responses, there are some psychological responses that can happen once you've had an injury. So you've got the 5 stages of grief. So we've got denial, isolation, anger, bargaining, depression, and acceptance. So just to explain these, so denial and isolation, this is the kind of first reaction after an injury. So this is where you don't think it's severe. You're trying to convince yourself that you'll be okay, denying how bad the injury might be. So let's put this into a scenario. So if there's a league final competition in 2 weeks, and you then are going to get a grade 2 tear in training, 3 weeks you're going to be on the side, so you're going to miss this league final competition. So if after the injury you're going to have denial and isolation, because you're really going to deny how bad it is. You're going to be no, I'll be fine to carry on, even though you might not be. So this is a normal reaction to rationalise all the overwhelming emotions you're feeling. So this is a temporary defence mechanism that the body has in place. Moving on from this, we have anger. This is trying to mask the effects of denial and reality. So you're trying to work against this so people don't think you're trying to deny it. So this intense emotion deflects the expressed anger. So normally this goes on to someone that you're blaming. So you'll either blame it on your coach, on family, anything like that. So another link back to that scenario is you may get angry with your parents and displace all the anger onto them. Even though they have done nothing for you to get injured, they are there and it's easier to do that. So bargaining. This is the helplessness and vulnerability that you feel. So you, after say you have denied all this need for treatment, you're now thinking, well, what if I had seen medical attention sooner? Maybe I'd been able to have the treatment earlier and then been able to pay for that game. Or if you had trained harder or warmed up better, you would then think that you would have been okay. So this is now also one way you can do it. So back into that scenario, you may say that you would have, say you've injured your knee, you could strap your knee and then carry on training. Even though this might not be the best thing to do, you may bargain with yourself and with your coach to say, no, I'll be fine as long as I've got it taped up. Depression can also come from an injury. However, it doesn't, as with all the other stages, they don't all occur for every injury. It depends on the person and their personality, and also the situation they're in. So if they're not up for a deadline or a deadline of a game, then it may not be so severe. So depression can come from an injury. This is when you kind of confront reality and realise the consequences of the injury you've just had. So an individual can come despondent and then isolated from the group. This is because their routine changes. They can't go to training, they can't play. And especially in team games, this can really affect individuals, because you can see that their tactics are improving, they're working well as a team, and you are not part of that. So the final stage is acceptance. So this starts as kind of a transition. This is the move towards omission of an injury and adaptation of your lifestyle. So whilst the injury is present, you want to focus all your attention on the rehab and try and get yourself back as soon as you can. Even if it's not going to hit that deadline of the 2 weeks till that final league competition, you still want to be back in as soon as you can and get back with your team. So this is the kind of realisation that you need to let the injury recover, and it doesn't matter how long it will take. So we also have the 9 feelings of injury. These are the feelings that you go through after an injury and why they happen. So fear. This is the fear of the unknown, or you may feel fear also prior to actual diagnosis. So you're scared to know what's actually going to happen, scared to go back in case the injury is worse. So you could have a hospital appointment and wait for your x-rays to come back, and you'll have that fear of what if it's a grade 3 opposed to a grade 2 that you thought it was and would be back in enough time. You may also have fear when you go back to playing. So after you have finished your rehab and you've been given the clear to go back, you may actually be scared in case you make the same injury, because that may be slightly weaker from now on, depending on the injury that happened. Isolation might also be felt. Between weeks and months after diagnosis, you'll feel this isolation because you're not able to see the players as athletes, and possibly even on a social aspect if they are training all the time and have lots of games. So this is worse in peak season. Anxiety, so this will occur prior to diagnosis. You'll feel worried of how severe the injury may be, and also you may be anxious that you might not make it back for this important game that you have. So this is really the anxiety of how bad it is, and also how well your rehabilitation is going to go, as dependent if you can go back or not. Leading on from anxiety, you normally get frustration. So people can get frustrated with themselves, so not taking out precautions. So if they'd already had like a kind of niggle in their knee, they could have taped it, whereas because they didn't, they've then caused a proper injury to themselves, and they may blame themselves for this. So a lot of time with the frustration, it also then leads to having frustration of not being able to play, so it's frustrating not to be able to do what they enjoy. But the frustration often leads to anger. So this is, you'll be angry about how you can't get back, angry at the diagnosis if it's worse than you thought, and angry with whoever caused that injury to yourself. So denial is another feeling of injury. At the time of diagnosis, you may have a high denial because the doctor may be telling you you've got 6 months out, but you may think, now I'm going to get back in 4. This is a part of denial which really kind of works with yourself, because you refuse how bad it is and how much it hurts. Because of all these, you may have a lack of motivation. So this is the weeks and months after the injury. There's no motivation after that time, possibly because you can't train, you can't play, and if you're not meeting your goals, it's really hard to get back in. So say you have a plan to be able to lift so many weights after a period of time when you're in rehabilitation and you don't reach this can be demotivating, and you may then not want to try again. You may also have low self-confidence when trying to get back, because your first game you're going to be so much behind the rest of the players. You've been out for injury, you're not sure of their most current tactics, and this can be something really difficult on players. Depression is the last feeling of injury. This is when you're confronted with reality of being at home, isolated on your own, and starting to put on possible weight. So if you're not training as often, this can really affect.